So if you have a patient that comes into your office and they ask, what are the risks? Am I going to be okay? Am I going to be back up and running in no time?
So I usually tell them that the risks of robotic surgery are essentially the same as with open or traditional surgery.
Okay.
Infection, bleeding, hematoma, hernia recurrence, among others. But usually I think those risk factors tend to be, or those complications tend to be a little bit less.
Okay.
The robot really allows you to visualize stuff better. And if you can visualize everything better, you can do better surgery. Let's
get into the technique of the robotic surgery. A mesh is inserted to where the hernia is. So explain for us what this mesh does and what happens to the muscles and to the hernia as you insert that mesh.
It's a synthetic material that we use to basically reinforce the repair. There are other types of mesh which are biological, and they're made from either porcine or from human tissues. Mm-hmm. And basically it's a scaffold. And what we use it for is to reinforce the repair. Initially we stitch or tack the mesh to where the hernia was. And over time, over the course of a few weeks to a month or two, it integrates and tissue grows into it and forms new tissue. So basically it's like forming a scar to reinforce the repair.
So the hernia is removed or corrected, and the mesh is inserted to create new tissue.
Exactly, to try to buttress or reinforce that repair.
So the muscles surrounding this hernia, what happens to them? How are they affected during surgery, or nothing happens?
So usually, you stitch the fascia, which is what encases the muscles. Mm-hmm. You want to bring that anatomy back to its normal position so that the patients can have, full use of their core muscles again. Mm-hmm. And the mesh kind of becomes a part of you. It basically scars in. It doesn't really affect your mobility in any way, but it does reduce greatly the risk of a hernia coming back.